Okay, we'll be beginning with the respiratory system now. The respiratory system obviously is the system that allows us to breathe. It is controlled by the central nervous system. We don't have to think about it, it kind of just does it for us, so it's involuntarily controlled. Awake or asleep, we continue to breathe as long as we are alive. The nervous system controls the contractions of the diaphragm, which pulls air into the respiratory system. Then in the lungs, the oxygen diffuses from the air we breathe into the blood in the capillaries. And the circulatory system then delivers the oxygen throughout the body. This is also where carbon dioxide is eliminated through exhalation. The structures of the respiratory system are divided into two sections. You have the upper respiratory tract, which consists of the nose and nasal cavity, the pharynx, the larynx, and the upper trachea. Then you have the lower respiratory tract, which is the lower trachea, the bronchi, the alveoli, and the lungs. So we'll talk a little more in depth about each of these. The nose and the nasal cavity obviously is the first part of the respiratory tract to receive air from the outside environment. The cartilage in the nose holds it open to allow air to enter easily. There's the mucus secretions that moisten the air to keep the lungs from drying out. The capillaries lying just beneath the surface of the epithelium warm the air, again for benefit of the delicate tissues within the lungs. There are also olfactory cells within the nasal cavity that are sensory receptors for the smell. Okay, next we have the pharynx. Sorry, my phone's dinging. Turn it off. Okay, as incoming air leaves the nasal cavity, it's received by the pharynx. The pharynx acts as a passageway for both respiratory and digestive systems. The eustachian tube, tubes, plural, connect the upper part of the pharynx to the middle ear, equalizing air pressure on either side of the ear's tymphatic membrane, or the eardrum. The pharyngeal tonsils, also called the adenoids, are made up of lymphatic tissue in the pharynx and are discussed in the lymphatic system. We didn't really go into the adenoids too much, but basically it's just another part of the lymph system that helps to remove pathogens before it gets to the intestines, hopefully. If the lymphatic activity is high enough, the tonsils can enlarge and the air passage can be obstructed. So we talked about when we get tonsillitis, the tonsils swell. That's part of the lymphatic system, but it can actually cause breathing problems because you cannot breathe if you do not have your passageway, if the pharynx is blocked. Okay, next up is larynx. So this is simply your voice box. It lies just below the pharynx. The thyroid cartilage, commonly referred to as the Adam's apple on men, is part of the larynx. The epiglottis is a little structure in the larynx that prevents food from going down the airway. The vocal cords are connected to the larynx cartilage, and as air moves back past them, it causes a vibration, and that's what actually creates sound or speech, along with the movement of the tongue, control of the tongue for speech specifically. But just for sound, it's just the vibration. Okay, the upper trachea. So the trachea basically is your windpipe. The trachea is a tube-like structure, connects the larynx to the bronchi in the lungs. It has little cilia, or little hairs, little microscopic hairs. You see here on this how it's kind of showing little hair-like structures. That's the cilia. And this is there to help sweep foreign particles that get caught up in mucus toward the external environment. The unwanted particles are coughed out, spat out, or swallowed. Okay, moving on, we have the structures of the lower respiratory tract. The lower trachea is the first part we will speak of. So this is at the inferior end of the windpipe, or the inferior end of the trachea. And the air splits into two separate paths. Rings of hyaline cartilage hold the trachea open, and mucus and cilia cooperate to remove foreign matters from the respiratory path. The bronchi, the left and right branches of the airway following the trachea, are called bronchi. The bronchi enter the lungs, and each of the bronchi branches into finer and finer airways. Bronchioles are the smallest airways inside the lungs, and they do not contain any cartilage. Their walls are mostly made of smooth muscles, and they're controlled by the autonomic nervous system. Although the air that reaches the bronchi is usually warm, moist, and particle-free, mucus and cilia are still present to sweep any foreign particles out of the airway, or out of the respiratory system. So you notice a big trend with trying to keep everything out of the lungs, obviously. At the end of the tiny bronchioles, you have alveoli. This is where air enters the pulmonary alveoli and resembles, the alveoli themselves actually resemble little clusters of grapes. They have thin walls of simple squamous epithelium, and this allows for gases to be exchanged with the blood and the capillaries that wrap around them. Diffusion allows oxygen to move into the capillaries and carbon dioxide to move into the alveoli. Surfactants are secreted by cells in the alveoli to reduce surface tension and allow the alveoli to expand without stress. Then we have the lungs. The left and right lungs are separated by a section of the thoracic cavity that holds the heart and the large blood vessels, and is called the mediastinum. The tops of the lungs are just inferior to the clavicles, so just below the clavicles, and the bottoms rest on the diaphragm. The lungs are enveloped in serous membrane called visceral pleural, and the thoracic cavity is lined with a serous membrane called parietal pleura. The serous fluid that these membranes secrete provides lubrication to prevent friction between the two membranes, and also helps keep the separate layers of the membranes together. If you have, many of you already know, I have lupus, and pleurisy is really common with lupus, as well as several other diseases and stuff, or injuries even. And pleurisy is where the fluid kind of gets caught up between the pleural membrane, where it's not supposed to be, between the wall of the lung and the pleural membrane. So that can cause pain and a little bit of deep breathing difficulty from time to time. The concept of keeping the membrane layers together is similar to how water between two layers of plastic wrap keeps the layers close together while allowing them to slip past each other. And the same thing, like whenever you have pleurisy, then the fluid gets between the wall of the lung typically and the pleural membrane, and creates kind of like a pocket in there that's really painful. Okay, move on, let you watch a couple of videos real quick, only 2 so far, and then we'll come back from that and we'll continue on with the functions of the respiratory system. Okay, so what are the functions of the respiratory system? Well, the obvious would be ventilation or breathing. The respiratory system moves air in and out of the lungs, also known as ventilation. In addition, it also cooperates with the circulatory system to perform respiration, which provides oxygen to the body and removes the carbon dioxide. The carbon dioxide removal is very important. People actually die faster from carbon dioxide accumulation than from oxygen depletion. With ventilation, this is where the air is moved in and out of the lungs. Respiration takes the carbon dioxide out of the body, brings fresh oxygen into the body. The exchange must occur in both directions to be able to maintain that homeostasis, that balanced system we thrive for. The steps of ventilation include inhalation, also known as inspiration. This draws air into the lungs. It occurs as the diaphragm and the external intercostal muscles contract. The floor of the thoracic cavity is pulled down as a result of the diaphragm contraction, and the walls of the thoracic cavity are widened by the contraction of the external intercostals. The parietal pleural membranes are attached to the walls of the thoracic cavity and expand along with it, pulling air from the external environment into the respiratory pathways. Then we have exhalation. This is the process of exhaling or expiration, breathing out. It's when the air moves out of the lungs. Normal exhalation is a passive process. Mostly results from the relaxation of the diaphragm and the external intercostals. Respiration is the exchange of oxygen and carbon dioxide that occurs in the respiratory system. The exchange of gas occurs between our tissues and the external environment. The internal respiration or cellular respiration occurs when the cells and the tissues, occur within the cells and the tissues. And inhalation and exhalation are equally important for maintaining the proper chemical levels within the blood. The respiratory and circulatory system cooperate together to provide a transport mechanism for the blood gas exchange. And then it goes into talking a little bit about maintaining the pH balance as our secondary function. The amount of carbon dioxide in the blood affects the pH. If we have too much, it lowers the pH and the blood becomes more acidic. Acidic fluids destroy the cellular membrane and are harmful to the health of the cells. When the pH is too high, the body will try to raise the pH by increasing the breathing rate, exposing the lungs to more oxygen and getting rid of more carbon dioxide, thus raising the proportion of the oxygen levels within the tissues. If the pH is too high and the fluids are too basic, then the body can respond by reducing respiratory activity to build up carbon dioxide and acidify the fluids. So if you think about what happens when we hyperventilate, we start breathing really fast, we start taking in too much of oxygen, and they have people breathe into the paper bag, so that way they're breathing back some of that carbon dioxide back in to maintain that balance. Okay, the next function is speech production. This specifically deals with the larynx or the voice box. This is where the sound is created, as we've already said. The vocal cords vibrate as air passes over them, creating the sound. By combining the movement of the lips, the tongue, and the cheeks, and the speed of exhalation, we can control our voices and create precise sounds. And then our final function with the respiratory system is body defenses. There's some reflexive activities of the respiratory system that protect us from irritating objects in the airway. Irritation of the mucous membrane at the back of the throat or farther down the respiratory airway produces a cough. That's our body's attempt to eliminate unwanted material through the mouth. When the mucous membrane of the nasal passages are irritated, our body sneezes, thereby reflexively attempting to expel the unwanted material. And that is done, obviously, through the nose. Then next we talk about the effects of massage on the respiratory system. So the process of cellular respiration is enhanced by massage and manipulation of the tissues, partially as a result of increased circulation. So massage therefore enhances cellular respiration. Also, massage creates additional amounts of carbon dioxide to expel from the body. And massage can encourage slow, deep contractions of the diaphragm. And also it relieves respiratory congestion. We have specific techniques we can do called tapotement. And if you've ever had a child with asthma or had a family member with emphysema or COPD, you see people kind of pounding on their chest, that is a form of tapotement. Okay, so go through and do your activity, including the major components of the respiratory system, the functions, and the effects of massage. Email that in. And then let's flip over to page 246 in the pathology section and talk about some of the pathological conditions of the respiratory system. Okay, the first up we're going to discuss is the common cold. And the dog's not smiling, he's actually sneezing in this picture. The common cold is a viral infection of the respiratory tract. It may be characterized by mild fever, headache, sore throat, postnasal drip, congestion, and coughing. A cold is contraindicated during the acute stage of the actual cold, when they first are getting the cold, due to the fact that it is highly contagious. Indications: after the acute stage, during the subacute stages, and later, massage can speed the recovery of the cold. Again, we said the cold could be caused by a viral infection of the upper respiratory tract. That is your etiology. And treatment include rest, increased fluid intake, antihistamines, decongestants, and cough suppressants. Sinusitis is our next respiratory condition. It is a condition of inflamed paranasal sinuses. Infectious cases can be caused by a number of pathogens, and non-infectious cases can result from allergies or physical obstructions. Manifestations include headache, tenderness over the affected area, runny or congested nose, facial or tooth pain, fatigue, thick opaque mucus, fever, and chills. Again, sinusitis is also contraindicated during the acute phase because it can be caused by an infection, which would make it contagious. Anything contagious is a contraindication. Okay, massage may help sinuses drain and reduce sinus pain in the client with chronic or non-infectious cases of sinusitis. We can do specific sinus massage techniques over the sinus cavities to help increase with the flow and the removal of that. Again, we said the etiology could be pathogenic infections, or it could be allergies or physical obstruction. Treatments for sinusitis be increasing the air humidity and water intake, decongestants, corticosteroids, and antibiotics. And this is a picture of a healthy sinus cavity versus an inflamed sinus cavity. Okay, next up is asthma. Asthma manifests as coughing, wheezing, and difficulty breathing. Everyone's seen the commercial where the kid says it feels like he's a fish out of water trying to breathe. It can make it really hard for breathing to occur. Asthma is a chronic obstructive pulmonary disease that occurs when smooth muscles of the bronchial tubes constrict and their membranes are inflamed and have produced excessive mucus. The result is an asthma attack. which is marked by coughing, wheezing, difficulty breathing, especially exhaling. Clients who have asthma have typically been diagnosed by a health professional and know how to treat their symptoms. You never want to massage someone during an acute asthma attack. You want them to be able to actually breathe before you worry about relaxing them. And most people, if they're actually in an active asthma attack, they're not going to want you to massage them anyway. They're just focused on usually getting that emergency inhaler or getting somewhere for help. It can be very life-threatening. Indications for massage would be massage relaxes and improves the efficiency of tight breathing muscles, such as the diaphragm, the intercostals, and the scalenes. Again, never during an acute asthma attack. The cause of asthma is unknown. Treatments, they suggest avoidance of triggers, the use of steroids, and bronchodilators. Okay, this completes our section on the respiratory system. Complete all of your assignments, rewatch videos if needed, and complete your quiz. And we will pick up next time with the digestive system.